My name is Samuel Bierner. I'm from Texas. I was born in Denton, raised in Dallas, and went to all my schooling in Dallas up until I went to college, where I went to Middlebury College in Vermont, and then came back to Texas to go to the University of Texas Medical School in San Antonio. I did my residency training at the University of Washington Hospitals in Seattle, and then a fellowship in neurology at the National Institutes of Health. Following that, I returned to Texas, and I've been in Texas up until recently when I've moved here to Omaha. So I chose my specialty, which is physical medicine rehabilitation, because it is a broad specialty that involves the combination of problems with neurological disease and neurological conditions, musculoskeletal system, anatomy, and the physiology of the nervous system. And I became attracted to this after medical school and actually changed my specialty from pathology to physical medicine rehabilitation. And I've enjoyed it very much being in the field. It's an area that you can find your own niche. In this field, there's many different aspects to it. And so I've been very satisfied practicing it ever since. When I first sit down with a patient, I always do sit down because the first thing you want to do is make the patient more comfortable and realize that I'm going to spend some time with you and find out what's wrong with you. And I really want to just let them talk. The first 2 to 3 minutes, I ask a very open-ended question and let the patient talk. And many times, patients will tell you a lot of very significant information in those first 2 or 3 minutes if you're carefully listening to them. And then I will ask a series of questions to try to elucidate more information about their particular problem. When I was younger, I thought I wanted to go into physics, but decided when I was 15 to become a doctor. And then I focused my career on that. I graduated early from college and started medical school when I was 20 and graduated when I was 24. And have always decided since I was 15 that what I really wanted to do was help take care of patients and understand diseases and how people can get better. I started out my medical career in private practice for 15 years and then switched into an academic career much later than many people might do so. But I was attracted to the idea of being able to study clinical problems and try to find solutions and answers that are broader than just for an individual patient, and also to teach. And so I became a residency program director and have been involved in medical education at both the medical student level and the postgraduate level for the last 12 years. My favorite activity is photography if I have the time for it. Lately, because I have 2 growing children, I spend a lot of my time with them and helping them. But I love anything in the arts. I enjoy painting and art, sculpture. I love going to art museums. I love going to the opera and listening to music. So anything involving the fine arts, I very much enjoy.